A very good afternoon, ladies and gentlemen. Welcome to today's webinar. My name is Alysa from the National Cancer Society of Malaysia, and I am delighted to be the moderator for today's session. As you all know, World No Tobacco Day is coming up next Wednesday on the 31st of May, 2023. To celebrate, we from the National Cancer Society of Malaysia have organized a series of webinars entitled Harms of Harm Reduction in Tobacco Control, running from April to May 2023. This series of webinars aims to raise awareness about the false narrative of harm reduction strategies in tobacco control and their impact on public health. Over the past few weeks and webinar sessions, we have been exploring various aspects of harm reduction in tobacco control, understanding the issues associated with vaping and health, communication strategies in dispelling those common myths for our tobacco control advocates. We have been inviting representatives who are strong advocates in the field of tobacco control to share their expertise and insights in support of this series of talks. In the first session of this series, we discussed the false narrative of harm reduction, including understanding harm reduction as a principle, the usage of harm reduction in public health, as well as its successes, limitations, and shortcomings. In the following session, we explored the harms caused by harm reduction in terms of its misapplication of context, as well as the industry narrative and how it is coloring perception. In the third session, vaping as the new harm was introduced, with its associated health issues and dangers tackled during this webinar. In the fourth session, we looked into the perspective in harm reduction, introducing terms such as harm reduction and harm initiation. Understanding industry intervention and reasons why it continues to be in place were also discussed. In the fifth session, we explored the sources of myth and misinformation in harm reduction. We presented various sources of information on harm reduction, both unreliable and reliable sources, and we also had an introduction to distributors of information. In the sixth session, we pierced the veil by discovering communication strategies in dispelling harm reduction myths. As all of you, our viewers, are healthcare professionals, we looked into understanding HCP roles in tobacco control advocacy in the second last webinar of this series. And we also encourage advocacy within the daily healthcare process. Last, but definitely not least, today's session is the eighth and final session in this series, and we will be exploring the topic of the rocky road ahead, challenges from harm reduction to a tobacco-free generation. Due to unforeseen circumstances, both of our scheduled speakers, Dr. Munisami, as well as Dr. Norliana, are unfortunately unable to attend today's session. In place of these speakers will be Ms. Mahirah Ma'som, Senior Public Health Executive from NCSM, as well as Dr. Muaz Sayuti, the Principal Assistant Director of Tobacco Control Sector and FCTC Secretariat of the NCD Disease Control Division from the Ministry of Health. We are honored to have them join today's session. Now, today they will be exploring challenges from harm reduction towards societal mindsets and a roadmap to a tobacco-free generation and implementation of FCTC targets. Now, if anyone has any questions for the speakers today, please feel free to ask them on the Docuity platform, and we will try our best to answer as many questions as possible within the allocated time. So now, without any further, Ms. Mahirah, over to you.
Hello, can you hear me? Okay, just checking on that. Let me share my screen. And can let me know whether you're able to see it. Okay. Okay, so a very good afternoon, everyone. And thank you so much to the moderator, Ms. Alysa, for introducing me. As she mentioned, this is actually the final session of the Docuity series that we've had, and it is my honor and pleasure to be able to speak on Dr. Muralidharan's behalf with his title, Harms of Harm Reduction in Tobacco Control, the Rocky Road Ahead, Challenges from Harm Reduction to a Tobacco-Free Generation. So let's jump into it. So in Malaysia, we actually have a national strategic plan for tobacco control from 2015 till 2020. And the two major targets outlined that you can see here is actually for 2025, which is 2 years from now, that we want to have to achieve a prevalence rate of tobacco or tobacco product use at 15%. And by 2045, we hope to achieve a prevalence rate of tobacco or tobacco product use at 5%. So to reach these targets, WHO's Framework Convention for Tobacco Control, FCTC, and the Ministry of Health Malaysia at the national level have outlined the following policies aimed at lowering the prevalence of individuals using tobacco products. Okay, this policy is called Empower, and I'll go in a bit more detail as to what it is. So this is, as I mentioned, the two main targets and a bit more detail. So here, as you can see, is the policy called Empower. Now, what does it mean when we talk about Empower? Let's go into it one by one. Okay, the first letter that we can see here, M, is actually for monitor tobacco use and prevention policies. So what sort of activities can be done here is, for example, the first one being, we want to try to gather data using scientific methods and protocols to monitor the use of tobacco and tobacco products among the population. Other than that, we can actually try to use the data to advocate for strengthening the tobacco control policies. The second one, P, stands for protect, which is protecting people from tobacco smoke. So what do we mean by that? Is actually some of the things that we can do is to create smoke-free indoor public places. We know now, and certain places have already have it implemented to have specific outdoor public spaces for smoking, the designated areas, the things that you see in parks, in open areas where smokers must only smoke in that area outdoors. But now we want to try to make it for indoors as well. Other than that, we want to try to reduce the exposure of non-smokers to second-hand smoke. So these people who don't even smoke are still actually exposed to secondhand smoke. So we want to try to curb that. The third letter, O, is to offer help to quit. So it doesn't help when we just tell people to stop smoking. Quit smoking, don't do it, quit your vaping and all your other shisha and whatnot. But we also need to try to offer help and get them away and to stop their bad practices. So it's very important to provide services for individuals to quit tobacco-related activities. And on top of that, we want to try to provide medication for these individuals to quit tobacco. So we know we actually have NRTs, nicotine replacement therapies, gums and things that can help at least try to make them less addicted. So these kind of practices need to be in place as well as we try to help the population who are involved in smoking and vaping to try and stop it and make them quit. So for W, warn. So we want to warn others about the dangers of tobacco. So things like comprehensive health warnings on tobacco packaging, so people know actually what they're going in for, what are the effects of tobacco, taking tobacco or smoking or vaping can do to them. So then they can at least make an informed decision and know that if they take this step, this is the potential consequences. And of course, very, very important is public awareness and how we disseminate all the anti-tobacco messaging. So I'll go into a bit more detail about that as some companies, actually many, try to advertise and showcase the benefits and what's so cool about vaping. So it's important we try to post that with all the anti-tobacco messages showcasing why they have negative consequences and why is it bad for us to start on them. Okay, so the next letter, E, is for enforcing bans on tobacco advertising, promotion, and sponsorship. So over here, we want to ensure that there are complete bans on direct and indirect tobacco advertising promotion. and sponsorship, so that this applies to complete and all the marketing categories. All the tobacco industry have a lot to gain, and they are extremely aggressive in their marketing. So enforcing these bans is a big move to try and curb this. So lastly, R is to raise taxes on tobacco. So studies and research has proven that when you raise taxes on tobacco products, it's actually quite effective, and it decreases the affordability of tobacco-related products. Over here, so you can see that's exactly what I mentioned, the different terminologies, the terms, and the different activities that we can try to carry out under the Empower measures. Okay, so how is it that the tobacco industry, specifically here, undermine the Empower measures that we are doing using e-cigarettes and other vaping products? So one of the narrative that the tobacco industry is doing is they're telling the individuals, if they switch to e-cigarettes or other vaping products, then the tobacco industry is actually helping the country achieve its goal. So as you saw, for Malaysia, we have the targets at 2025, 2045, we want to reduce the usage. So they're saying, okay, so you should use e-cigarettes, you should use vapes. So there'll be a decrease in the prevalence. But over here, prevalence is a very narrow interpretation of only conventional cigarettes, the usual ones that we see people smoking. In this manner, the industry will present the narrative that the prevalence of smoking is decreasing. But in reality, the population is merely turning to another mechanism of nicotine delivery, and it's not changed much at all, and in fact, can even make it worse. Okay, so the second narrative that the industry shaped is saying that vaping smoke is safer than the smoke from conventional cigarettes. And they are saying that the latter contains thousands and thousands of chemicals and carcinogens. So in this manner, vaping can protect the individuals from secondhand smoke. Basically, vaping is a measure to protect people from secondhand smoke. But it is not true, as the vapor from e-cigarettes and other vaping products has been found to contain many different chemicals and carcinogens, and it definitely affects the non-smoking individuals around them. A lot of studies have shown this and proven especially that a lot of the safe chemicals and materials that are in vape are actually unsafe and poses a lot of harm to the individuals when inhaled. Okay. So next, what they try to say is that in largest claim that the e-cigarette company tries to say is that it is an optimal choice for users to quit conventional cigarette use. So it has not been proven at all. And evidence reveals that conventional cigarette users are just switching from one form of nicotine delivery to another form, which is not in fact harm reduction, but harm substitution, as we have shared earlier in our series. Another way that actually ends up happening is that the user ends up being a dual user and will take on both the conventional cigarette and the e-cigarette and other vaping products. And this actually is harm intensification, and it gets more intense. The effects are more intense compared to a person having cigarettes. So it's not helping at all. So they tried to warn the public about the dangers of tobacco while insidiously marketing e-cigarettes and other vaping products. So as I said here, so they think this is actually a solution to the problem, but it is a very misleading narrative, and they try to promote and advertise their product in place. So for example, here you can see all the marketing advertising going on to try and promote the different e-cigarettes, vaping, or essentially the tobacco-related products, and try to convince people to take on, to switch, and to use their vape products instead. Claims like there's 0 deaths in the last 15 years when you inhale nicotine vapor, or vaping is 95% safer than smoking. All the different flavors, you taste better, you feel better. So these are things being pushed out by the industry to promote their product, which is exactly what we are trying to prevent. So finally, what the industry is asserting is that e-cigarettes and vaping products are essential quit smoking tools that need to be readily available and accessible at a low cost to smokers who wish to quit. So due to this, the proponents argue that e-cigarettes and other vaping products should not be subjected to control measures, including high taxation, which is espoused by empower measures. So in reality, the low cost of these e-cigarettes and other vaping products would enable individuals to switch easily and become dependent on these new nicotine delivery products. Moreover, the accessibility of these products often results in individuals using both conventional cigarettes and the new e-cigarettes. Exactly as I mentioned earlier, they become dual users. So through these implementation strategies, the industry has been actively undermining empower measures by encouraging the use of e-cigarettes and the vaping products. And the effects are clearly seen already, with kids being able to pick up these things, the different attractive packages available, and if anyone can just use it, then they will just, because it's so accessible, then the youth, the teenagers, and the kids will also just start taking vape, and they can just save up their pocket money to buy it because it's so cheap. So we're trying to look at a tobacco-free world, a place where we don't have to worry about tobacco or the after effects, the negative consequences of it. And what a lot of different countries are trying to do is work towards this smoke-free, tobacco-free status. And this particular goal can vary. So each country has a specific target year that they want to achieve this status. They have a target prevalence of use. They want a certain number by a certain year, or they try to have a specific generation that can only access it or make it inaccessible to other generations. For example, let's look at Malaysia first, our country. So we had in July last year, the tabling of the Tobacco Product and Smoking Control Bill. So this particular bill prohibits the use of vaping products and will include those who are born on or after 2007. So anyone after that, they should not, and makes it illegal for them to take on any tobacco products. And this, we are hoping to protect the future generation once implemented. So depending on the prevalence and legislation, the strategies to achieve this to achieve this smoke or tobacco-free status, it can differ. Yeah. Largely based on the policies outlined by the FCTC. The principles are very similar, and the main aim is to denormalize smoking or the use of vaping products. So we're going to have a quick glimpse on the different measures and strategies used by various different countries around the world, starting with England, which aspires to be smoke-free by 2030, about 7 years from now, whereas Scotland targets by 2034. So these two countries are aiming for a prevalence of 5% or less. And for Finland, another example, aims to have a prevalence of 2% or less by 2040. So that's, as I mentioned, are specific time targets along with their prevalence use. So there's the other method, which is the generational targets. So for example, New Zealand, actually, first country in the world, already did it in 2022, last year, December, where they passed a law to prohibit cigarette sales to those born on or after January 2009. And so some of the cities or countries in their smoke-free generational targets, they have included vaping products in their legislation. So for a brief while in 2016, vaping products along with tobacco were included in the ban of sales, use, and advertising for those born on or after 2000 in Palanga City, Philippines. Oh, it's very close neighbor for us, and they've already started doing their measures. Going back again to Europe, in the Netherlands in 2020, they have extended its smoking ban to e-cigarettes. Its advertisement ban to heated tobacco products devices in 2020. And by 2023, another country example, the Dutch government, they had banned nicotine pouches and allowed only tobacco-flavored e-cigarettes. So at a quick glimpse, these are, as I mentioned, the various strategies taken on by different countries. We'll go into a bit more detail for Australia. So they have implemented restrictions on e-cigarettes as well. So for example, this year in May, the Australian government had placed a ban on the recreational use of e-cigarettes, which prohibits the importation and sale of non-prescription e-cigarette products, including those that do not contain nicotine. As for the therapeutic use of the e-cigarettes, the sale and purchase of e-cigarettes is only allowed through a prescription from a certified doctor. So yes, they're trying to curb it, but in a way it's more controlled. So you can't just get it anywhere off the street, just buy it from a vending machine, which is what you can see happening nowadays at certain places, but it actually needs a certified doctor to prescribe it. So right now, Australia is in the process of regulating the packaging, flavors, colors, and ingredients even, and banning the sale of single-use e-cigarettes. So this decision was made to protect public health, especially the youth, from the potential risks associated with e-cigarette use. Another country that we'll go into a bit more detail is for Finland. So if you see the roadmap of Finland, which is known to have stricter regulations of vaping products than other EU countries, the country's action plan to be smoke-free include 4 major areas. What's the first one? It is preventing the initiation of tobacco products, especially among children and young people. They are already looking out for the future generation. 2, supporting current users of tobacco products to quit. Again, one of the empower measures where we all offer help for people to quit. Number 3, Finland also aims to create a smoke-free environment to protect people from secondhand smoke. Already applying another empower measure, we're making it more friendly for non-smokers. And lastly, number 4, Finland aims to prevent new tobacco products from being launched on the market. So again, right now, there's absolutely no law and new products come all the time. It evolves all the time, making it that much more dangerous for our public and the future generation. So as you can see, what Finland is trying to do, it actually goes against the harm reduction principles that's narrated by the tobacco or e-cigarette industry. And in fact, the Finland Ministry of Social Affairs and Health, when they were developing the plan, expressed concerns that vaping products are actually encouraging young people to try smoking. Again, which is what is happening here. Young people start off when they were a non-smoker, non-user, start off with vaping, something harmless, and go into something more intense, more negative consequences, such as smoking and other tobacco activities. So the Finnish country, they oppose the narrative that vaping products should be widely accessible and states that its legislation on tobacco control is firmly grounded on a principle that products that are based on reducing harmful effects are not allowed on the market. And they regulate nicotine-containing e-liquids under the Medicines Act. So its legislation on smoke-free environments also includes e-cigarettes. So it's not just our normal traditional cigarette, but now e-cigarette is part of that legislation, which is a big step forward, including it in there, opposing this narrative. So where did this come from actually? When you have a smoke-free generation, this movement, this control of trying to regulate the industry, you actually have 2 of it. Historically, we've had the opium products as well as currently alcohol use. So when this roadmap is created, when you're trying to phase out addictive substances in society, we looked at how was it done for opium and alcohol use. We're going a bit more detail for the opium aspect. So in 1908, Formosa's opium-free generation were built on the following principles. Because at that time, there was widespread opium, people were just getting addicted left, right, and center. It was affecting society, affecting economy, of course, health and productivity of the country. So what happened was, number one, opium was placed under governmental monopoly. Secondly, the principle was to prevent the initiation of non-opium smokers, including promoting the negative consequences of smoking opium. So again, curb it before it begins. Prevention is better than cure, and try to not even have people start on the addictive negative product. And they also would regulate the purchase of opium among current users. So not just have it sold anywhere, everywhere, accessible cheaply and all that. And lastly, encourage the current opium smokers to quit. Definitely, there's a lot of people who are already addicted, so measures were taken to try and encourage them to quit. And you can see within 16 years of implementing this roadmap, the usage decreased by 80%, and it achieved its goal within 35 years in British Ceylon. And this was then prompted to help the recommendation on tackling alcohol abuse. So you can see, again, if we look at the current measures, empower once more, you can see it in place, a lot of work and measures taken to prevent, to promote and showcase to the public and advertise why is it bad, and the regulation of it instead of just letting it go anywhere and everywhere, accessible. And lastly, we try to offer help and encourage people to quit. So as you can see here, with the increasing prevalence of vaping products as well as smokeless tobacco products, a lot of healthcare professionals and researchers are now actually advocating instead for a nicotine-free generation. Okay, it's not just about smoke-free, cigarette-free. Try to make it all encompassing and inclusive of all these negative products, and we target for a nicotine-free generation. So while tobacco control or smoke-free legislation already includes the products that imitate it, the tobacco use and deliver nicotine, it's very, very scary how fast the nicotine delivery methods, the products available, evolve so quickly. It's taking different shapes, it's having different mods and tanks, flavors and colors. So we do want to question and try to make it more inclusive to see that nicotine-free generation would be more appropriate to the public. And that would then encompass all the measures and efforts that's being taken now. So we'll try to switch that narrative from, again, smoke-free to nicotine-free, as that is the harmful addictive substance that we are trying to combat. So that's all on my part. I'll pass it back to the moderator. Thank you.
Thank you, Ms. Mahirah, for your informative and very insightful presentation. Now, let us all welcome Dr. Muaz to share his thoughts on this topic. Dr. Muaz, over to you.
Hello all. Thank you, Nariza. Thank you also to Puan Mahirah for explaining about the previous on the empower and explaining on what we call the roadmap to the tobacco free generation. So I will share my slide. Wait. Okay, ladies and gentlemen, today I will share with you on the roadmap to the tobacco-free generation. So previously, Puan Mahirah had explained on a few measures using the empower how we want to control, to control the tobacco in Malaysia using the FCTC Framework Convention on Tobacco Control using the Empower. So I will elaborate more on what have we done, what have been implemented using the FCTC article in Malaysia, and what have we achieved, and what we should do more to achieve what we call the tobacco-free generation. So first, I will explain to you about the law and the regulation which is related to smoking in Malaysia, and then I will explain to you the tobacco endgame and the implementation of the article of FCTC in Malaysia, and lastly, what is our next step and what we should do next. So if you all can see the tobacco control, how is it started in Malaysia? So Malaysia had already become a signatory on the 23rd September 2003 on the WHO Framework Convention on Tobacco Control, and rectified the WHO FCTC in 16 September 2005. And then, of course, in Malaysia, the Ministry of Health is acting as the Malaysian Government Secretariat to the WHO FCTC Convention, which also known as the FCTC Malaysia. So when we adopt the FCTC, when we sign the signatory, then we amend, we have the control of tobacco product regulation, or what we call as CTPR, to control all the tobacco product, using the control of tobacco product regulation 2004. However, the control of tobacco product regulation is just a regulation that is put under the Food Act 1983. As we know, of course, tobacco is not food. So initially it should have its own act to control all the smoking and the tobacco product. And then we also have the NSP, National Strategic Plan. This is our second national strategic plan, which is for 2021 to 2030, which also include our target to the national to the generational endgame. And then, of course, we have the new bill which is coming, which I also explained to you what is our road to these new bills, what have we done, and what are we going to do next. Okay, so towards the end game of the tobacco, of course, we have our target. For example, the NCD global target is in 2025, we should reach 15%. 15% of the percentage of people who are smoking. And then using our national strategic plan, we have the end game target, which is in 2040 actually, which the numbers of the percentage of smokers should be less than 5%. This is what we call the end game. So what is when we define the end game, when we define the tobacco-free generation, what is the tobacco-free generation is when the generation have a very low smoking prevalence, less than 5%. As we know, even in now the drugs, even we are controlling, we prohibit the use of drugs for however, we know there are still people who are using the drugs illegally. And then, of course, when the smoking prevalence is very low, then it will end the commercial sale of the tobacco product. So when I said about the tobacco product, of course, it's not only meant for tobacco product. It will also include all the smoking products, including all the new smoking products such as e-cigarette and vaping. And then when the prevalence is very low, the act of smoking will be denormalized. So this will be very the culture of smoking will be something that is not normal in the population. And then of course, what we want to achieve is zero exposure of tobacco use in children, or what should we say, there will be no new user for all the tobacco product, all the smoking product include all the vaping product and e-cigarettes. And we don't know what product will come, what smoking product will come later. Okay. So what are we doing? What have we done? So this is a few implementation from that we do in Malaysia. For example, from the WHO FCTC in Article 6, there is a price and tax measure to reduce the demand for tobacco control. 75% of the retail selling price. This is 75% is the cap of the WHO recommendation. However, in Malaysia, the implementation is we have a fixed tax rate at 40% per piece of cigarettes. So if the cigarettes contain 20 piece of cigarette, so it will be about 8 ringgit per box. So are we achieving this? No, because for example, for the most popular brand, about 17 ringgit, so the tax percentage is only about 46%, much lower from the targeted percentage by the WHO and the recommendation by the WHO, which is 75%. So we also have the Article 8, which is protection from exposure to tobacco smoke. Of course, what we have implemented in Malaysia, we have the Regulation 11 under the CPPR 2004, where the public places such as restaurant, public transport, terminals, sport complex, and other are declared as a non-smoking area. So, however, this is we still not achieving what have been advised by the WHO FCTC, because the prohibition of ban on smoking at public places in Malaysia is not comprehensive, as it does not entail to the gazetting all public areas as non-smoking zone. So this is why we are different from other developing countries or other developed countries, which they gazette a specific place, they gazetted a specific place to smoke, and all other areas they cannot smoke. So this is very different from what we are doing when we only gazetted a specific place which people cannot smoke. Okay, and then in the Article 11, in controlling of packaging and labeling of tobacco product, we have the health warning on the cigarette packaging, which should encompass of 50% or more. And then according to the guidelines for the implementation of the Article 11, it is recommended for all the parties to adopt the plain packaging, which is we don't have right now. And then for the packaging measures, which aims to restrict or prohibit the inclusion of logos, color, brand, image, or promotional information on the packaging except for brand name and product names, which is displayed and it is standardized color in font style. So this is the plain packaging. So what we are having now, what have we implemented in Malaysia is under the Regulation 15 from the CPPR 2004, which we have the health warning on the e-cigarette, which encompass of 50% coverage from the cigarette box. So this one, we achieve a very minimal requirement, and then of course we still don't have the plain packaging, which has been implemented in other countries, such as the Western Pacific region, for example, like Australia, New Zealand, even our neighboring countries such as Singapore and Thailand. So we still not achieve the Article 11. So for the Article 12, which is education and communication training and public awareness, which each party shall promote and strengthen public awareness of tobacco control issue using all available communication as appropriate. So in Malaysia, we have done a lot of promotion, we have done a lot of activities. We have programs like Takna, we have programs like Gegar, 18, and so on. So for this part of the article, we believe that we have achieved what have been recommended by the WHO SCPC. And then for the Article 14, which is demand reduction measure concerning tobacco dependence and cessation that take effect measure to promote cessation of tobacco use and adequate treatment for tobacco dependence. We also achieved this, which we already implemented the smoking cessation services, which have been conducted in our KK, in our health clinic, and also we also have the Jom Quit program, which is the service that has been expanded to the private sector, which people can get access to smoking cessation by joining the www.jomquit.com. Okay, and of course, when we have the new smoking device, when we have vape and e-cigarette, this the smoking station will become a great challenge for us. For example, as we know, when we do the smoking cessation program, when we previously we have a guideline for CPG for tobacco use or cigarette, normal cigarette. However, the vaping product is very different from the use of tobacco, because how they use the vaping product is very different. Their routine is very different. For example, how many puff they use, how many sessions, and even in e-cigarette, they can use it. They will use the e-cigarette anywhere, because the device is built so that they can vape anywhere they want. In comparing with the normal cigarette, we have to light the cigarette first, and then of course the smell and others. And then for the Article 16 on the sales to the minors, to adopt, implement effective legislative, executive, administrative, or other measure at the appropriate government level to prohibit the sale of tobacco products to the person under the age set by the domestic law or national law of 18. So this one actually for tobacco product, we have the prohibition for minors, which under Regulation 8, which prohibit the sale of tobacco product to a minor who is person below the age of 18. And then we have the Regulation 13, which is prohibition on smoking, buy and possession of tobacco product against minor or person who age under age of 14 and the age of 18. However, this is not fully achieved, because we know this regulation did not cover for the new smoking products such as e-cigarette and vape. So as we can see now, all the minors, if they until now we still don't have regulation or any act that we can use to cover this product. And then what we already explained to you, to all of you, what we have done in Malaysia. So despite all what we have, the measures from the Empower and the measures that we use using our regulation, the smoking prevalence in Malaysia is still high, which is 1 in 5 adults is a smoker. This happened since 1999 until now. Although the percentage, we can see the percentage is slightly reduced. However, I believe the numbers are slightly increased because the number of population of our population is increasing. So this is as a percentage. So of course, when it comes to the e-cigarettes, this is the latest survey, our latest adolescent survey. We can see the increasing number of e-cigarette users among youth from 9.8% in 2017 increased significantly to 14.9% in 2002. So this is very alarming to us. But however, we can see from the cigarettes use, they are slightly reduced from 13.8% in 2017 to 6.2% in 2022. Because right now, the e-cigarettes is becoming more popular among the youth. As we can see also, the female composed of 6.2% of the youth among female are the e-cigarette or vape users. So, of course, the legislation related to the e-cigarette for the HTP right now, for the tobacco product, we control it under the CTPR 2004. However, the device, there is no control on the device for the HTP. On top of that, of course, the vaping product, the e-liquid previously which contained nicotine was previously governed under the Poison Act 1952 and then has been exempted. And now we don't have any regulation or act to control all the smoking products, all the new e-cigarette and smoking liquid. Just for liquid, we don't have any act or regulation to control it. And then this is the existing, like I said, the existing law and regulation for the selling and then promotion, labeling, and then prohibition to sell to the person underage. For the tobacco and tobacco product, we already govern it under the CTPR. However, for the electronic cigarettes and for other tobacco other smoking product, because now we also have like a product of cigarette that use, for example, tea leaves and others, which sometimes they also put the nicotine in the tea leaf that they use it for smoking. And then of course, if we saw all of that, so what we need now is we need a new bill. So this is the proposed new bill that had been proposed in last year when we have two parts of the bills. First part is when we want to regulate all the smoking products, include the tobacco product and also all the new smoking products such as e-cigarette and vape. And then also in the new bills, they also have the generational ban, which we ban the selling and use of the tobacco product, which include also the electronic cigarettes or vape to the person who was born 2007 onwards. So this is just a repeated slide. So what I want to show to all of you is the roadmap. This is the road that the path that we have went through for the bill. So it started long ago from 2003, and when the and then until 2022, when the bill is passed by the AGC and then was read for the first reading in the parliament, and then the second reading, and was referred to special Jawatan Kuasa Khas, and then of course, however, in October 2002, we know the resolution of the parliament, and then now we are starting over we have to start over the process to present this new bill to the Parliament. So the road is very long. However, I believe all of us, we should do what we could to protect our generation from all the smoking products, because we know, for example, when they say cigarette is the gateway to drugs. However, now we have a new product such as vape and e-cigarette, which I believe is not a gateway. However, it is what I always say, it is a highway. It is a shortcut to the use of the drugs and all substance, illegal substance. Okay, for that, I would like to thank all of you for hearing me in this evening. So thank you.
Thank you, Dr. Muaz, for your insights today. I believe everyone would agree with me that we've had some fantastic presentations today. I believe we do not have any questions, so we might just conclude the webinar today. So yeah, as mentioned, that brings us to the end of our webinar for today, bringing us to the end of this series of 8 webinars. So as we come to the end of this webinar series on the harms of harm reduction in tobacco control, NCSM would sincerely like to express our deepest appreciation to all our speakers today, as well as for the past 8 sessions, for kindly sharing their expertise and insights with us throughout this entire webinar series. And as for all of you, our viewers of this series, we would also like to sincerely thank you for your presence throughout these insightful discussions. So over the course of this webinar series, we've explored a wide range of perspectives and different viewpoints on harm reduction strategies in tobacco control. And while our exploration has certainly been, very thought-provoking and insightful, it's important to acknowledge that harm reduction in tobacco control is very, multifaceted and is a very polarizing issue. It encompasses, various viewpoints, from those who see it as a pragmatic approach to minimizing harm associated with tobacco smoking and to protect public health, but others who see it as a concern about and are concerned about unintended consequences and the potential normalization of tobacco use. But it's important that through these conversations, that we've been having over the past few weeks, that progress is made as we, continue to challenge assumptions, confront biases, confront myths, and, try to discover some sort of common ground. And as we bring this webinar series to a close, it's crucial to recognize that our work definitely does not end here or today. The challenges posed by tobacco use and addiction continue to persist, and finding effective solutions definitely remains a priority. So we have to continue to, engage in discussions just like the ones that we've been having, and focusing on evidence-based interventions. And obviously, our goal should be to try and strike a delicate balance between harm reduction strategies that are carefully evaluated, while also keeping in mind on the current broader public health objectives. Let us also not forget the individuals that are affected by tobacco-related harms. As we, as healthcare professionals or people working in public health, we continue to examine the merits and drawbacks of harm reduction. We also have to, remember and always prioritize the well-being and health of those who actually bear the brunt of tobacco addiction, the very people that we are trying to help. Their voices, their experiences, their struggles should be the ones guiding our actions and, compel us to seek comprehensive and evidence-based approaches so that we can address the root causes of tobacco use. And lastly, NCSM, we just want to encourage everyone to continue to carry the spirit of this webinar series forward with you, wherever you go in your careers. Let us remain open to new ideas, continue to be committed to evidence-based approaches, and also be determined to find solutions together that prioritize public health and the well-being of our communities, because together we can make a difference in the realm of tobacco control and continue to strive for a future where the harms associated with tobacco use are minimized. Thank you once again for joining us on this enlightening journey. May our collective efforts continue to pave the way for a healthier, smoke-free, nicotine-free world. Thank you to everyone involved and happy World No Tobacco Day.